Well, the basic issue is, does the government have a right to offer timely health care, not deliver it, and then outlaw a citizen's right to access that health care for themselves?
Cambie Surgery Center opened in 1996, so that's 18 years ago. It wasn't the first private surgery center, but it's definitely the biggest, if I'm not mistaken. Did you always assume that a trial like this one would be a certainty?
No, because I was hoping that the political leaders would have the courage to do what's right, and what's right is to look at the system, evaluate it in the light of other world systems, and recognize that it's morally and ethically wrong to force people to wait. And we are the only country on earth that has laws that say that a citizen cannot look after their own bodies using their own resources if the government won't provide those resources.
Cambie and other clinics seem to be functioning without any government interference for many, many years. Then what changed?
I think what changed was the public sector unions, particularly the BC Nurses Union, which is one of the interveners in this case, launched a suit to try and force the government to enforce a law or laws that we argue are unconstitutional. We're basically fighting to give British Columbia residents the same rights that the Supreme Court of Canada granted to Quebec residents. And right in the wake of the Chowley case, the Premier of this province said, in response to being questioned what his thoughts were, said, well, we're not going to have a two-tier system in Canada, one for Quebec and another for the rest of us. We're going to have to change. And of course, as we discussed earlier, the politicians have not followed through on that intent. So this is a case about our patients. Our patients that are, in the Charlie case, there was one patient, Mr. Zeliotis. We have had 7 patients, 2 of whom have died. And these are just examples of more than 1 million across Canada, patients who've suffered under the health system, who are continuing to suffer, who are deteriorating as they wait, and the government has really turned a blind eye to patients.